I'm here with Kenyon Farrow of thebody.com, and a few days ago I got an email from Kenyon saying, let me talk about what's going on with respect to COVID-19, the coronavirus. So, mission accomplished. Kenyon, welcome back.
Thank you, glad to be here.
You've been following this closely. This is part of your business. It's also part of your life.
Yes.
What are you thinking?
I think that one of the problems right now is that we're not getting the kind of accurate information from the federal government or from our local and state officials about the severity of what's happening. So therefore the inertia to kind of put the public health sort of controls in place to kind of wait out the window period so that people could not be transmitting the virus. We don't have enough tests. And so we don't have these things in place. And so therefore there's kind of a mix of panic and a kind of, people kind of not really understanding what's going on. And so therefore not maybe taking some of these measures seriously. So I think we have both a kind of an infrastructure problem, political inertia, and then the communication issue in terms of telling the public what's really going on and what they can do.
So two questions. The first, what is this revealing about our society? And then the second, what of all of this has echoes of the past and the experience that we all lived through of AIDS, HIV? And are there lessons from that period for this one?
I think what it reveals about our society is that, and to sound very, hippie about it, we're all very connected and we live in a more connected world than ever. So the fact that there is no, borders in the sense that you can, stop an infectious disease from spreading, right? So I think that is one of the things.
I mean, even Donald Trump's wall, his putative wall,
that
will not protect us.
That wall will not protect us at all. And actually, it exposes that. It also exposes the lack of just infrastructure that we have to be able to take care of people. So the fact that we don't have a single payer, a Medicare for all, where everybody has coverage if you are, live in this country, so people could just get access to care. We actually don't even have enough tests, right? We're not testing enough people to find out who's sick. So it exposes some gaps there. And then also it exposes things like paid sick leave that we don't have federal laws for, those things where people could stay home and not worry about not being able to, meet bills if they had to in fact stay home. So I think it exposes, some of those real gaps that particularly in this election season, people really need to be paying attention to the candidates they support at every level who are going to support these kinds of initiatives. And I think because we haven't seen this kind of an epidemic or pandemic at this point in the United States in a long time, I think people have kind of forgotten how, terrible this can be. So to me, I think those are some of the major lessons we have to really learn.
And echoes from the past? Lessons from the past?
I think there are some lessons, partly from the AIDS epidemic, but even going further back, in terms of the Spanish flu in 1918, right?
You were not alive.
Right? I was not alive, right? But in some ways that is also slightly more analogous. But I think in terms of the AIDS epidemic, which people probably, obviously have a more close memory of, ways in which it is similar is that we had a period where it was clear that an infectious disease was happening that was initially blamed on a community. So initially, the fact that we called it gay-related immune defense, what is a gay-related immune problem, right? That doesn't make any sense. But that was what it was called for, some period of time, months or a year, until, we realized it was human immunodeficiency virus, right, that was causing the illness, and that people did not have to be gay in order to contract it. So I think we have those lessons to learn. We also have the lessons to learn that governments actually have to tell the truth, and they have to tell the truth to people rapidly. And we just heard today, just before I got here, that in another news outlet, that apparently the White House officials have tried to make all briefings about coronavirus to them from the other federal agencies classified. So therefore, CDC director HHS director, Tony Fauci at NIH, can't actually talk to the public or share, what they're learning about how the virus is moving, how quickly, what else people need to know, new cases that may expose some other sorts of groups at risk or whatever. And so I think we're learning that those lessons are kind of being repeated again if we remember the fact that Ronald Reagan did not want to talk about AIDS, in this case because of his own homophobia. But government inaction can actually make a problem spread even faster.
The flip side of the AIDS story was that activism moved in, and we transformed the relationship of the patient to the expert.
Yes.
Flipped it in many circumstances. What's applicable from that experience, that side of the story?
What's applicable about the kind of AIDS activism and the current situation is that people have to empower themselves to learn about this epidemic where government is failing them, right? And people also have to demand that certain actions be taken. And that is actually beginning to happen. And actually, some of our noted AIDS activists are actually already moving in terms of their engaging both the city, the state, and the federal government about not moving fast enough in terms of alerting people to, what the real dangers are, and both for, people who may be at risk for contracting, but just for many of us who might contract but not actually get sick, we may still transmit it to people who do. And so not communicating those things, and also to think about people who are particularly vulnerable. So senior citizens, people who are homeless, people who otherwise don't have great social support networks and who don't have necessarily access to certain kinds of care, to really push for infrastructure to be put in place so that everyone can be taken care of. And I think that it's that piece of the activism that happened then that is beginning to happen now and definitely needs to move forward.
So interestingly, in an era of divide, them and us, the virus is calling us to remember there's just an us.
There's just an us, and that if you think that something couldn't happen to you, or it's just those people over there, an infectious disease often can remind us that we are far more connected than we sometimes want to think that we are, and that investing in things that may support people who are more vulnerable than you are actually may benefit them and you.